Welcome to the wonderful world of wellness with Dr. Andy Mencia. This medical program heard from 7 to 7:30 each Saturday right here on WSBR 740 AM is brought to you by the Adult and Geriatric Center under the medical direction of geriatrician Dr. Andy Mencia.
Well, good morning with the beautiful sunrise. Good morning,
Ina. I know it. It is
Dobre
beautiful.
Utra.
Dobre Utra. Guten Morgen.
So
morning.
where's all your Russian? Do you know I invited you? I told you to go to that Russian.
Or what?
Yeah, the
That
Russian
chamber?
recipe.
Yeah, the Russian recipe.
I told her, take a picture of Richard on your phone
Yes.
and put it on the front. So every time he pop up,
Because
I have to bring the Russian
the only time I
recipe.
remember it when I come in and Richard, did you bring your Russian recipes? Oh my God.
The Russian recipes for everything?
No, I don't know. For everything.
Is it for everything or just food or what?
I guess the food.
Well,
we're going to have to patent that one.
you know, Dr. Mencia, it's funny that it isn't funny, but I wanted to go back about this. Do you mind? I want to invite that woman again who had the breast cancer.
Yes, absolutely.
I have her name, and I want to
she's
make
willing
sure.
to come.
Yeah,
Dana.
because next week I think you're going to have
Yeah,
a whole
she
hour.
want to come. Yes.
And I will. Now, does she live here?
No, she moved north from here.
But she'll
But
come.
she comes.
She said
She
she would
always
come
comes
down.
for all
So
her
if it's okay with
appointment.
you, I
She
will try
will-
to get her because that's an
She will
unbelievable
not
story.
change her team. She said, I have my team that Dr. Mencia put together for me, and I will not change. She will travel down here and see her, the doctor she's been seeing for over 10 years, and she's very happy.
Because of the breast cancer. I mean, when someone was told, we could wait and talk about it, but just to give a little brief subject that she was told that she had breast cancer and that she had 4 months to live, and now it's 10 years later.
Right.
So we want her to be on
the
the
thing
show.
is like with breast cancer, it's like, think somebody been told, oh, you have HIV or something, major. And when you hear breast cancer, people get so scared that they just got super aggressive. Take both breasts out, take my lymph node, give me chemotherapy, give me radiation. And that's not necessarily the case. You have to, in medicine, like in everything, you have to be a tailor. If you come to get a suit for you, and Ina come to get a suit, I cannot pick the same suit. You have to tailor something for you that you're going to look nice, and something for Ina that she's going to look nice also.
He always does this. He makes it so clear,
Easier,
doesn't
right?
it?
Yeah, because, a person can have the mishap of being diagnosed with breast cancer, but how advanced it is, how early was it detected. And like I said, I just had a patient that was diagnosed with pancreatic cancer. Everybody knows pancreatic cancer is a killer. And, I was so blessed to be able to make the diagnosis with my 2 hands.
Your 2 hands.
Before I did the ultrasound, I was palpating her abdomen, and I felt this little lump on the left side of her abdomen, of her abdominal wall. And thinking of the anatomy, I said, it's only 2 things that sit there, the spleen and the tail of the pancreas. So I palpated and I said, let me have Anna, my sonographer, do an ultrasound. But before she even went for the ultrasound, I had my nurse draw some blood. Okay, I said, give me the pancreatic cancer tumor marker. Just draw the blood test for me. So we drew the blood. We got the ultrasound. Lo and behold, here's a mass at the tail of the pancreas. And I said, well, if it's pancreatic cancer, it's at the tail, we can still save her life. And make a long story short, she just came to see me with her daughter. Post-surgery, we had to take the spleen out.
Well, wait, I don't know what the spleen does.
The spleen is like the lymph node. It's the largest lymph node we have. So when the blood gets cleansed, it goes through the spleen. And then when the waste material is going to be removed, it goes through the kidneys.
And what if you don't have a spleen?
The only thing you have to make sure you have your pneumonia shot. Because most people without a spleen, they are very blunt. Well, the spleen is like a large lymph node, let's call it. So if you don't have that, the lymphatic system, everything goes through the spleen for cleansing and to throw waste material back into the kidney so we can get rid of them. So if you don't have the spleen, the only thing we have seen on those people, they are prone to pneumonia. Pneumonia can kill them. So those people get vaccinated prior to the spleen being removed. A lot of times the surgeon know to make sure those patients get vaccinated.
Well, anyway, I had last week. I went and had my flu shot
Your
at
flu
Dr.
shot.
Yes, right, Dr. Mencia, and I never suffered with it. I had no soreness, perfect. And now I'm going to go. I can get my pneumonia shot because I've waited a week. Right?
You waited a week. You're good for the
I'm
pneumonia
definitely
shot.
going to do it.
Absolutely.
Now we don't talk much about shingles, and I once had it just mildly for about a week. But do you really believe people should be having shingle shots?
Absolutely.
You
Everybody
do?
over the age of 55.
Have you had a shingle shot?
No, not yet. No, I'm too young. You got it, Richard.
Richard said he got, so I should get one, right? I mean, did you get shingle shot at the same time you get pneumonia shot? Or you
well, I like to break them. No, I like to break all the immunization. It's like, kids when they get their immunization. They are basically naive to any of this immunization. So it is better to separate the immunization just in case you get a reaction. And for those people that don't like to get vaccinated because, let's say, they got the flu shot once and they got sick, what they need to understand is they happen to have an excellent immune system at that time when they got sick. So imagine your body never being exposed to the flu shot, and suddenly, for the first time, you expose your body to the flu shot. It's like a little kid when they get vaccinated. You have to give them Tylenol. They're going to develop a little fever because, their little body had never been exposed to these injections. So for the adults that develop a horrible reaction when they got the flu and they won't get any more, is the contrary. That means you have an excellent immune system and your body has responded robustly to the shot. And the next time you get the shot, now your body is going to recognize that. I say, oh, this is the same thing they gave me last year, but you already have the system waiting for it and ready to build immunity so that if you get exposed to somebody with a flu. And, it doesn't take much. Sometimes people think I had a guy that came with a pink eye, a little conjunctivitis, and he's a chef in a big yacht, and he developed conjunctivitis. And he said, I don't remember being exposed to anybody with that pink eye or conjunctivitis or anything like that. I say it doesn't take much. All it takes, somebody with the flu or somebody with a transmissible infection,
really?
all it takes for them to rub their eye or to cough into their mouth with their, with their hands, and then grab the knob handle, the door handle. And when you open the door, then the person coming behind will touch the same handle, and there you go, the transmission. Or you go to a waiting room, you grab a newspaper, you grab a magazine. Somebody have already put a magazine down, and so you can transmit it in not only by being cough on your face. You can, people can transmit it if you touch this book, and I touch the book, and the virus still live and kicking. So when if I touch my eyes, then I will transmit it to my eyes.
And so we don't wash. I know I don't wash my hands enough. I think you're telling me I should be washing my hands a lot, shouldn't I?
We should, and in the, if you notice in the exam rooms, all the exam room, we have soap there. We even have the quick one that you don't have to put water just to kill the bacteria. But we have it on, and one of my nurses, she wash me when I touch the patient, and I'm going to touch my stethoscope. She goes, chop, chop, squirt
it
on my
first.
hand. Yeah, so just like my mama.
Yeah, your mama.
Anita.
But it is important, and I don't think about doing it enough. In fact, I think that's sometimes when people. I'm trying to. We all touch our faces. We touch. I mean, I've touched everything here,
right?
And I haven't really washed my hands
during flu season. What you need to do is carry the little soap with you, At least
yeah,
carry
they have that spray. You
the
mean-
little spray soap, any of them, they're all good. Something that is not too dry, that's not going to dry your hand. A little moisturizer so your hand don't get too rough. But just carry with you. When in doubt, squirt some.
Because I was thinking about that. Many times I go
How you
out to
squirt,
dinner.
Dana?
What?
How you squirt?
Squirt?
No, it's on this microphone. They don't hear you. There you go.
That was a squirt,
That's
right?
going to be in a job from now
So,
on.
that's it. Okay, now you can go home, right? You did your squirt, right? So tell me, Dr. Mencia, now that it's it's almost December, what is happening with your patients? What are you finding that's more common than not? And I don't know if people are coming in with the flu already, or what is it that you can tell people, from your experience? What's going on?
The worst thing that I have seen during this time, and I already started seeing it at the office, people that go and get sick and they come running to get their flu shot. And I say, sorry, you are sick now. You have to take the antibiotic. Come back next week. Let me see how you are doing. And the problem with this infection, what I'm seeing so far, and it looks, that it's going to be the trend, when the person get infected, it can linger for 3 weeks or 4 weeks or 6 weeks. So which means you cannot get in the flu shot until this thing is completely out of your system. And, it's a pity because you want to give the flu shot to the person, but you can't until they are completely cured or whatever they have. And a lot of times they take antibiotic for 7-10 days and the infection had been eradicated, but they have what we call the lag syndrome. They're just lagging behind. So the infection is gone, but everything in the breathing pipes are trying to heal up. And until that heal completely, you're still going to feel the sensation to cough. It might be just a dry cough. But because you have lost the barrier that was protecting those breathing pipes from the blood vessel and the rest of your lungs, you have lost that barrier. It takes minimum to re-expose you to anything.
Yeah, it's pretty serious because
Yes, it
an
is.
older adult can't take that excessive time afterwards. It really takes them down, doesn't it?
Absolutely.
A young person maybe can get through it. So let me just tell everybody, live in the studio here in Boca Raton is Dr. Andy Mencia and Ina.
From Boca Raton.
Ina, our very special, wonderful woman here who chauffeurs him.
Squirts and soap.
Yeah, right. This is good. It's a whole new thing we're doing now. I love this. Anyway, Dr. Mencia has grown his practice so much. People are so happy with him. They now have another center, and it's also there in Boynton Beach. So if you want an appointment, whether it's in Broward County or Boynton Beach, let me give you the phone number to call. It's 954-489-1345. That's 954-489-1345 for an appointment. And also, they do home visits. And now that I hear the weather's going to get cooler, but I just know that there are a lot of people who are at home, have not seen a doctor because they can't get out, and it's their health is deteriorating. That's not necessary. You can go to AGI Medical and Dental Centers. Go to their phone numbers I just gave you. Home visit services are available for homebound patients. And Medicare and most major insurances are accepted. So, Dr. Mencia, are you
And your
seeing...
list is outdated.
It is?
Because Dr. Garcia just started seeing patients at the office, so we have a rheumatologist for the joints.
Oh, wait. That's true. At the office.
Yes, she came to, she's seeing patients. She's doing primary and rheumatology.
Yes, she is doing
consult
rheumatology.
at the Boynton office. But at the Fort Lauderdale office, she's doing only rheumatology consults. And she's excellent. The patient love her.
So she's going to the Boynton Beach office.
She's go and see patients there. So when they need to see a doctor, because she's like me, an internist, my specialty is geriatric. Her specialty is rheumatologist. So she can be an internist but also a rheumatologist.
Okay,
So she goes to Boynton. She is there several
Saturdays?
days a week. No, she's not doing Saturday.
That's right, because she has that. She has a little baby.
Yeah, we have to be
so
nice.
okay, so she's in Fort Lauderdale during the week, as well as Boynton
She started
Beach.
last Tuesday, right, Ina? Last Tuesday?
Okay, yeah, we have to get this down here. Then we have to.
You know,
We're out
shaking
of
the
date
head,
here.
yes. I mean, yes.
Yeah, we got to do that. You know, I don't know what's going on here.
Yeah.
I'm kind of just sitting and observing all this. But that's good news. But I really, I do have to say that people just can't imagine what it's like to be a very old person at home and nobody's visiting them and they don't get a doctor to help
They
them.
don't get a doctor.
It's a very serious problem. I hear that a lot of the family members, they're trying to go take care of their families, but they can't take care of them like a doctor can.
And, we have Dr. Richard that is one of the doctors that will go and do home visit with the nurse practitioners. And
are you getting a lot of this? I hope you are getting home
we're
visits.
getting a lot. We are not trying to be overwhelmed with home visits. We're looking at the market. It had been abused.
How is that?
Well, instead of a doctor going in to see the patient or a nurse practitioner, you just get nurses going in. And it's not the same. If I need a nurse to come in, I call one of the home health care agencies that I trust, and I know they will report to me and what have you. But I want a nurse practitioner or a doctor if we're going to go there. I don't want to undertreat my patient. I don't want to abuse them because they are homebound. They're already been abused by the system. When you are homebound, it's hard for you to get your medication there. It's hard for you to get your medical equipment if you need a wheelchair or a seat for you to sit down and shower. I feel good sometimes just to be able to take a shower, but you are afraid because you don't have a bar to grab to or you cannot stand for more than 5 minutes. So sometimes you can have a chair. There are many equipment out there that can be used, and I usually like to bring the expert on that to come by the house, the occupational therapy, so that they can go and assess what else can we do with the modern equipment that we have to help the patient. And, sometimes you have age difference between husband and wife. So the wife might need a chair, but the husband still able to go in there or vice versa. So the chair is portable. You can put it in, sit down, take a shower, and when you are done, the chair can come out and the other person can take a regular shower like they had done normally all their life.
Very good advice.
So, it's people think it's, it's a death sentence. It's not. There are stuff we can do for the patient. And the idea is to age at home.
Analyze what's going on at the house,
Yeah,
and then help them with ideas which they really don't
because
know about.
the scapegoat had been nursing home.
Yes.
You cannot be home anymore.
Yes.
My mom
Yes.
cannot be home anymore. So nursing home, and sometimes nursing home can be a death sentence. There are many good nursing home out there that treat you with more of a social aspect of care. Social aspect, I mean that they are not there to follow a clock schedule. They are there to follow a human schedule.
I love that.
So they are. I was talking with one of my dentists, and I said, "Do you want to come tomorrow to be one of the staff?" He said, "No, I really love to sleep in the morning." And I said, "Well, it's a guy." I said, "Thank God you are not my wife."
Right.
Because I love to get up early in the morning.
Yes.
I'm up by 4 o'clock in the morning. I love getting up early. So if I'm in a nursing home and you want to give me medication, which is usually what happens, if you're in a nursing home and you get up at 3:30, 4 o'clock, because that's your clock, that's your time, the nursing home will give you a sleeping pill to put you back to sleep because it's not time.
Really?
And if you want to sleep until 10 o'clock, some people like to sleep late. Like my doctor, he was saying, the dentist, he said, I like to sleep late. He will have a problem because 7 o'clock you have to get up to have your medication. He might not want that. So, Nursing home have lost, if you notice on my title, it say MD, CMD, Certified Medical Director.
Yes.
It means that I'm on the board of the Florida Medical Director Association, and our job is basically to educate nursing homes. And one of the things that I strive in doing with those nursing homes that I have some influence is to follow more of the social aspect of medicine. Right. Where the person want to sleep late or get up early. As long as they have enough hours of sleep, there is no need for everybody like soldiers, like Hitler. Okay, 7 o'clock, everybody on their feet. It doesn't work like that,
Good for you.
And nursing home sometimes I run like Hitler style.
It must be hard for you when you go in as a physician. I know you don't do that as much anymore, but years ago you probably...
I want to create my own nursing home.
No, and it'd be a wonderful, it would be full all the time, unfortunately.
Yeah. Well, I can individualize everybody. And
in the last few minutes we have, I wanted you just to maybe if you could cover... When people are at home,
I'm not leaving. Richard, don't cut us off.
Well, next week you're going to have an hour. But I want you to cover when people are home and they're in bed that they have to be very careful about bed sores. Very careful.
Very
that's
careful.
The worst. That can take them down.
Yes, absolutely.
And I don't know if you have any advice about that.
Well, yeah, with bed sores, there are a few advice. Number one, keep it clean and dry in your bed. Keep it clean and dry. Check your mattress. A lot of time when a person tends to sleep on the same area on the mattress, it will sink in. So you have to move the person to the middle of the mattress, to the right side, to the left side. You move the person like a pancake. Don't leave them on the same spot because that will make you prone. You will sink in and make you prone to sweating and to having the barrier of the skin to break apart. And that's a bed sore. Never, when the person is, let's say, sliding toward their feet and they grab them by the shoulder to pull them back in bed, that friction, when you pull a person in bed like that, can provoke a blister that will open and become a huge bed sore, huge one. Because those blisters, the skin is so fragile as we age. It's very thin. So... a teenager, you can pull on a teenager and you might produce some redness, but it won't blister. But an elder person over 70, 80, in their 90s, you pull on there, the skin is so thin now that the friction between the skin and the bed will push the skin aside and open up into a blister and will open up.
Well, we can maybe have more subject on this because we don't have much more time, but I think it's never covered very much. And I know that from my own personal experience, my mother wound up with one. It took a year for it to get better. And that's when then it has killed people. And we know that because, you've talked about it. But thank you, Dr. Mencia. And I'm glad to know that now we have a rheumatologist, which the article was wonderful, and that beautiful Dr. Garcia on page 5. So we hope that everyone has a great holiday.
A nice holiday. Happy Thanksgiving.
Yeah, everyone's going to have a good turkey, hopefully. And I know that, gobble, gobble. See,
I want it.
You know what? We want to thank you very much for being here again. And it's the phone number to call is 954-489-1345. And the website is agifl.com. Thank you both so much.
Thank you.
Bye. Thanks for listening to The Wonderful World of Wellness with Dr. Andy Mencia. Be sure to tune in each Saturday morning from 7 to 7:30 right here on WSBR 740 AM.